our webinar. We're from the NIHR Specialist Centre for Public Health Research. My name's Kasia Koroska. I lead the public and community partnership work from the Specialist Centre. The webinar today is about creating a public and community involvement engagement strategy. I've got the chore of doing some of the housekeeping at the start of this webinar, so just bear with me a second. You'll have heard this many, many times. The session is being recorded, so please do remember to keep your microphone off during the presentation. Also feel free if you want to keep your screen off as well for comfort. The presentations today are, the webinar will finish at 11 o'clock. We've got some presentations. We've got two fantastic HDRCs, Health Determinant Research Collaboratives, who are going to share their experience of creating a strategy and how they've gone about it. And we're also going to hear from Donna as well, who I'll introduce in a minute. We will have at least 15 minutes, hopefully, at the end for questions and answers and discussions. I know that many of the people on the call today may have also been doing their own work around a strategy, so please do share that as well as part of the conversation. We'd love to hear from others that might be exploring how to create strategy or have done it. The slides from today will be shared, and also a copy of the recording will be shared with you all, and there'll be an evaluation form that comes out and a link to that. Please do fill that in, because that's super helpful to make sure that we're running the right kinds of webinars with the right kind of content for you all. During the webinar, you can access closed captions by clicking on the More button on your Teams toolbar, and that'll bring up language and speech, and then you select CC live captions. But my colleagues are also going to put information in the chat about that in case anyone wants to use that. So without further ado, I'd like to introduce Donna White, who is going to do a welcome and introduction for us. Donna is a Senior Research Manager at the NIHR Coordinating Centre, working within the Prevention and Public Health Strategic Commissioning team. Donna brings over 15 years of experience working across various areas within the NIHR, and for the past 2 years has been responsible for the oversight and delivery of both the Health Determinant Research Collaboratives, the HDRCs, network, and also the Public Health Intervention Response Studies teams, the FIRSTs. So Donna, thank you so much for joining us, and I'll hand over to you.
Thank you. Right, let's hope the technology doesn't fail me. It's been okay in practice, so I'll just wait for the slides to appear, and then they're having difficulty loading a presentation. Oh, great. Sorry.
That's all right. It's just like, it's an occupational hazard with these webinars, trying to share, getting the right screen. We did, for colleagues who joined us, we did all practice this before you all joined, believe it or not. We all joined and tried out. Yay, they're there.
There was just a little delay. There we go. Just while obviously lots of people joining couldn't cope with the demand. So brilliant. So yeah, so hi, thank you very much for the introduction. So I'm Donna. And yeah, just again, thank you for inviting me to come along today. So it's just really good to see just such a big so many people joining, and hopefully over the next 10 minutes I'm going to just be able to set the scene for the session by exploring a little bit about why having a clear and well thought out public involvement and community engagement strategy is essential for local government research or evidence gathering activity. So whether you're developing a new service model or evaluating a programme or collecting insights to inform policy, your ability as obviously those who are working in local government to create meaningful, to be able to meaningfully involve communities can make the difference between a project being one that simply collects data or a project that truly kind of improves lives and builds that sort of co-production and into it. So just to set a little bit of context, so as you're probably all aware, local government in the UK is operating in a period of rapid change and challenges, and councils are grappling with budget constraints, rising demands for services, sort of widening inequalities within the communities, and obviously sort of that leads to then increasingly complex social issues, from sort of health and care integration to issues around decarbonisation and housing and safeguarding. And there's obviously then the expectations at the same time around sort of transparency, accountability, and the need for participation from communities sort of never been higher. So communities are not only being asked to inform about the discussion, but they want to be, communities are not only being asked to be informed about decisions, but they want to help shape them. And obviously through national policies such as those sort of the work that we do for the NIHR, we're kind of obviously pushing in the same direction. So whether it's the emphasis on co-production, the focus on lived experience, or from funding bodies like ourselves, we're requiring sort of demonstration of that public involvement. So against this backdrop of high quality research and evidence generation within local government is no longer really optional. So councils were increasingly relying on robust research, and that's both quantitative and qualitative, to help design effective, efficient and equitable services. But obviously research conducted without these people ultimately affects and tends to miss the mark of those things that are important to those who are impacting on. So it risks, by not having public involvement in, risks overlooking the diversity of experience of those who living in those communities. So this is where public involvement and community engagement strategy becomes really essential. So it's not a nice to have, but it's really part of now a core responsibility of having impactful research. So just to go kind of briefly over sort of the benefit of having why having the strategy matters, it obviously helps improve the quality and relevance of the research. So the people who live, work and engage with local services have practical everyday knowledge that some professionals may simply just not have. So when engaging with them, the communities, we can obviously help shape the research question, methods, recruitment strategies, and help interpret the research of the evidence that's produced, so it becomes more grounded and reflective of obviously their real life needs. So a good PICE strategy ensures that the right voices, especially those who are often less heard, come forward and are also included right at the very start of the journey. It also helps strengthen trust and legitimacy, and through the HDRC network, we've obviously been hearing a lot about that's a really important thing when working with the communities. So we obviously know that trust in institutions varies significantly across, and when residents see that research is being done with them rather to them, it builds obviously confidence in the process and the decisions that follow. Meaningful engagement can demonstrate that local government is listening, transparent and committed to equity, and this can be particularly important for groups who have historically been underserved and marginalised, or potentially even over-researched without seeing any benefit. It improves participation in reducing non-engagement, so having a strategy that considers the language, the cultural accessibility and digital exclusion, and obviously community relationships, helps overcome barriers that often prevent people from taking part. So without having this, research risks hearing only the usual voices, so those who are already confident, empowered and well connected. A strong PICE approach ensures research samples are more representative and the insights are therefore more comprehensive and meaningful. A good strategy supports better decision making and stronger outcomes. So research is only useful if it leads to change. So when communities are involved through the process, they help shape recommendations that are realistic, appropriate and implementable. This makes policy adoption smoother and increases the likelihood that interventions will succeed in practice. It fosters collaboration and shared ownership. So working with community groups, voluntary sector organisations, service user networks, and faith groups, and all the other partnerships that you might come in contact with across the organisations will outlast individual research projects. These relationships can help councils better anticipate the emerging needs and co-create solutions, and obviously build stronger social capital within the neighbourhoods. So just to sort of go through some of the risks that having no strategy may have. So the challenges without a strategy, before we talk a little bit about what good looks like, I suppose it's important to recognise what happens when local government approaches are done on an ad hoc basis. So we've talked obviously in the past around tokenism, and obviously the importance of people not feeling that that is part of what they're doing. So when people are consulted only at the end and the decisions have already been made. There's obviously the issues around fatigue, so as I've previously mentioned. The same groups are repeatedly asked for input, whilst others are never reached. The inequality of having no strategy, certain voices often dominate the conversation and existing qualities become reinforced. And obviously, again, inconsistent quality. So different teams engage in different ways, leading to potential duplication, confusion, or contradictory practices. And again, I think most importantly, probably this lack of impact. Communities see little follow through, which damages this issue around trust and reduces participation next time. So these challenges don't occur because local government lacks good intentions. They occur because without a structured strategy, engagement becomes reactive rather than proactive. So what a strong strategy enables. So a well thought out design helps councils clarify who should be involved and why, help plan how they will involve people across the research cycle, understand what resources, time and skills are required, ensure involvement is inclusive, ethical and proportionate, helps embed these feedback loops so communities can see the value of their contribution, and obviously builds a shared culture where engagement is seen as everyone's responsibility and not just as an isolated task. So ultimately, a good PIE strategy gives structure, coherence and a purpose to engagement, ensuring that research is shaped by the lived realities of the people that the councils aim to serve. So just to very briefly summarise, in today's complex local government landscape, research that genuinely reflects and responds to community needs is essential. Public involvement and community engagement is not simply about communication, it's about partnership, co-production and creating evidence that is richer, more equitable and more actionable. Having a clear PIE strategy makes this possible. It ensures that engagement is not an afterthought, but a foundational element of how we design, research, generate knowledge, and improve the outcomes for our local residents. With that context in mind, I'd now like to introduce how this can be done, and I'm pleased to welcome three speakers. Natasha Mercer is a public involvement and community engagement lead for Doncaster's HDRC. Natasha brings over 20 years of experience working with underserved and underrepresented communities for the past 2 years, has chaired Doncaster's PIE steering group. Additionally, Natasha serves as Doncaster's lead for the NIHR Race Equality Patient Advisory Group framework. Priyanka Vasantava is a project officer with HDRC in Sandwell, where she works on public involvement in research training and governance. Previously, as a public health research practitioner in Oxfordshire, Priyanka gained experience embedding research into council priorities, collaborating with communities and translating evidence into action, skills that now underpin her work in shaping research and culture and practice. And Erin Beach is a project manager leading on a community participation and has worked at Sandwell Council for nearly 5 years, holding such roles as a community development worker in housing and development officer in public health. This background has helped Erin to develop relationships with organisations in the borough, which has supported her engagement work and is helping her build a sustainable community-led research culture within Sandwell.
Thank you very much. Quite an intro. I will try to share my presentation. Can everybody see this?
Yeah, we're good, Natasha.
Excellent. Thank you very much. Thank you. So, yes, as has been said, I'm Natasha Mercier. I'm the Public Involvement and Community Engagement Lead within the HDRC Doncaster. I'm just going to talk you through our journey in terms of our research and engagement strategy. Okay, so our journey started way back in May of last year, when we had our first HDRC public involvement and community engagement event in Doncaster. Important to say that this event was attended by local government officers, not the general public, more voluntary and community sector organisational leaders who were representing Doncaster's diverse communities. So the second half of the day was very much around our research and engagement strategy and really starting to formulate those research priorities. And to do that, we used the diamond ranking exercise. So this just gives you an idea of the activity. Table facilitators were given 9 cards with topics that were very much centred around the wider determinants of health. People were asked to discuss the topics and rank them in order, the first being the most important. People were encouraged to stick to the diamond shape. So because we'd already pre-printed, as I say, these cards with issues around the wider determinants of health, at a certain point during the activity, blank cards were given out to individual tables to say, okay, this is a starting point and this is what we think, but actually, is there anything really important that's missing from this that you want to write onto this blank piece of paper? So the main learning from the workshop, it's not necessarily the positioning of the cards, but the discussions that took place, which were also recorded. So this gives us an idea of why stakeholders believe some issues to be more important than others. The takeaway messages from the session included the importance of essential needs being met before addressing those sort of nice to have issues. There was a lot of talk in the room about the need to get this right, and a strong resistance to any consultation perceived as tick boxy. So we definitely didn't want that. And these are just the priorities from the day. So I'm hoping you can see that. It's very, very small on my screen, but top priorities came out as access to health and social care services, adequate housing, employment, and having access to fresh and good quality food. Mid-level priorities included neighbourhood, employment, environment, and there were some additional factors raised around access to safe green spaces, having enough food, and crime rates. We also had conversations during the afternoon around how people wanted to be consulted with. And again, that revealed a strong preference for community engagement to be interactive, to be ongoing, so closing those feedback loops, and to reach as many people across Doncaster as possible. So the second stage of this, and beyond the PICE event, we realised that we needed to go out and speak to some of our elected members. So as opposed to the first list that I showed you, this is the same kind of setup. It was the same diamond ranking exercise, but obviously this looks slightly different. So in terms of priorities from the elected members, we have access to fresh and good quality food, adequate housing, access to health and social care services and education. Mid-level priorities came out as crime and safety, access to green spaces, local environment. And some of the additional factors raised were around community enterprise and cohesion, transport, digital inclusion and childcare. So that's sort of quite interesting in terms of how they differ depending on the different groups that we were speaking to. So I took this next slide directly from a bit of a write-up that my colleague did of the session with the elected members. I almost feel like she's been quite diplomatic. It was definitely an interesting session. So as is stated here, participants expressed amongst our elected members uncertainty around what had already been researched locally, suggesting greater knowledge mobilisation efforts directed at elected members, feeling that that might be useful. There was a lot of talk around Doncaster-specific data to guide in decision-making. Some of the elected members felt that existing national research may not reflect local realities, and that some development of guidance around applying evidence from other places locally might be of use to us. The group also emphasised the need for practical, actionable insights rather than abstract data. So we've taken all that on board. We did recognise that we had further work to do. So as I described at the PICE event last year in May, we had voluntary and community sector individuals in the room, but we realised that we were very conscious of the fact that we were missing the actual public voices in this, as well as there being a bit of a gap around children and young people. So we realised that research priorities would probably look different through a child's eyes. So in terms of this year's PICE annual event, we decided to make that all about pulling together the strategy. So I pulled together a planning meeting and included public contributors in the planning of that. That was a really interesting process because we really wanted this to be collaborative and co-produced in terms of the planning for the day, but we really struggled to reach that consensus in terms of accessing all voices from across Doncaster. So there felt like there was quite a strong resistance around doing things in the way that we're probably used to doing things. So, you know, the plan loosely was kind of to have an event in central Doncaster and try to reach as many participants or as many people from across Doncaster so that we're really getting those diverse views and voices. But it did really feel like there was a strong resistance to that, and that maybe wasn't the right approach for this actual piece of work. So essentially, we decided to take our event or take the exercise to the people. So this was our change of approach. So you'll see here, this is a quick and easy exercise which enables people to be able to say what matters to them in terms of research priorities. I'll just give people just a little bit of a second to have a read of that. I'm hoping that people can see the writing that's on the rainbow as well. So essentially, people were just asked to put a coloured sticker onto the parts of the rainbow in terms of what's important to them, and people were asked to choose up to 3. This is a similar exercise where people are asked to put in order what they feel is important to them from the list on the right-hand side. So yeah, essentially, we did a bit of a mapping exercise in terms, as a HDRC team, in terms of different events taking place across Doncaster, trying to tick off every locality. So far, we've been out to Doncaster Pride with the exercises that I've just shown you, to the local women's health event, to the central Gurdwara, and to a celebration event held by the Nepalese Gurkha community locally. In terms of further events that we have planned, you'll see from this list here, going out to see the local Chinese community, our local Muslim ladies group, our Polish Saturday school, going to engage with our youth council, Doncaster People's Focus Group, and Doncaster Mind. And that's by no means an exhaustive list. Okay, so that's our journey so far. I'm going to stop sharing. Okay, thank you.
Thanks very much, Natasha. We'll wait for questions until we've heard from Erin as well, if that's all right, and Priyanka. We'll have the conversation at the end, but thank you so much. And thank you for being honest about the kind of process and involving elected members in it, trying to reach those parts of the population, residents that you haven't, and the challenges of bringing it all together. Yeah, we'll probably discuss that with the group in a minute. But Erin, would you like to share your experience in Sandwell?
Yeah, of course. I'll just share. Can you see those?
Yeah, all good.
Perfect. So it will be myself and my colleague Priyanka who will be presenting this. So just for context, I lead on the community participation and Priyanka did most of the work. I'm not going to take credit for it. So Priyanka did most of the work on the development of this strategy. So she'll go over kind of the main aspects of it. So we've called our strategy the Sandwell Public and Community Engagement Strategy, so SPACE for short, so that it's a bit easier for people to say and know what we're talking about. Just for a bit of context, so I always get asked this question, where is Sandwell, where is it? So we are bordered by 4 different local authorities, so we are just outside of Birmingham. So it is a very diverse area. It's the 19th most deprived local authority. So there is a lot of different needs, different communities in the area that we have to target and ensure that we're working with. So in terms of the community participation, this is where the space plan falls into. So this is what I lead on. This work stream is really just aiming to have local people involved in what we're doing so that they could have their say in public health research, and then lead to having their say in the decision making within the council as well. So we do this within 3 different ways. So public engagement, which is where the strategy fits into, research priorities and partnerships, and then also communication and dissemination. So some background to our space strategy, why we've developed it, because I know it's not something that all HDRCs have to do from the start, but it was something that was put within our delivery plan and bid to do within the first 1 to 2 years. So in terms of our space strategy, the aim was really to create a space for inclusive and meaningful community participation. So the aim of the plan was for it to be an engagement plan focused on our HDRC work, how we'll involve residents, community organisations in research, but also our wider HDRC activity as well. So like I said, it was a priority for HDRC Sandwell because we've got a lot of community and engagement strategies already within the council. It was a priority for us to see what's already going on and the gaps that we could fill and the gaps that we could discuss in terms of research and wider involvement as well. So we did focus on developing this in partnership with our co-applicants. We do have 2 community organisations that are umbrella organisations that were our co-applicants. So they supported the development of the plan, but also we focused on involving the community in the development and feedback of this plan as well. And then finally, we did use the UK standards for public involvement just to help guide the plan and to give it a bit more structure to begin with, so we weren't just making up as we go along really. And then in terms of our strategy development, just an overview of kind of how we've done it, just in kind of basic, and then Priyanka will go over the main aspects there. So first of all, we created a draft, very bare bones draft, using the involvement principles like I've just mentioned. We then took this to our HDRC governance structures, so these are co-applicants, but then also wider partners like NHS, ICB, community and voluntary sector organisations as well. Once we'd received this feedback, we then went out and did some community engagement activities. So again, Priyanka will go into this in a bit more detail. We then got some more feedback from these community engagement activities and made some amendments to the plan and amendments to the draft. And then finally, the last stage of it will be for it to have a board sign off from a HDRC governance structure so that we can publish that, send it out to people and have that kind of sitting on our website so that people can view it and see what we're trying to do as part of the programme. So I will pass on now to Priyanka to kind of go over the creation and the community engagement aspects of the plan.
Hi, everyone. So how did this whole thing come about? Like Erin said, we did it because we had to do it, but how did we do it? So like everything else, it started with a nice search of the intranet and the internet to find if anything already exists, so we don't end up reinventing the wheel. But this all began exactly a year ago. So it was November last year when we were looking at these things. And I found nothing. I drew a blank. All of my searches drew a blank. There were some PPIE strategies that existed, but nothing that was specific for local authorities. And there was also an issue that the terminologies that the existing PPIE strategies, which were I mostly looked at NIHR's PPIE strategies, various NIHR bodies PPIE strategies, and they all were quite patient focused. So I couldn't even find the proper terminology on how we could do this. But the one thing those PPIE strategies were good for is to identify what the heading should be in any strategy. So we know what structure we need to adapt and what we shouldn't ignore and what we certainly should have in a strategy. So they were useful for that. Building on that and using the UK standards for public involvement, which Erin talked about, we came up with the draft strategy, which the first draft. The first draft was pretty extensive in bits and it lacked a lot of bits because clearly two people can't think everything up. So then we took that and we shared it with our internal other directorates in the council, as well as our co-applicants and partners externally from the university and from the voluntary sector organizations. And they gave us their feedback. So it was pretty much an iterative process from the start. And then using their feedback, we kept revising it for the next couple of months. And once we had all the feedback in from our steering group and co-applicants, we thought we had a good first draft in place. Next slide, please. And then we took that draft to the communities and we did it in a very staggered approach, should I say. So Sandwell Council has this thing called Public Health Development Officers. So Sandwell is comprised of 6 towns, and these public health development officers have existing links with various organizations and communities that work actively in those towns and are from those towns. So I went to these public health development officer meetings in all 6 towns and met the residents as well as the organizations that are active there. I had a chat with them about the fact that we're trying to come up with a strategy because we want to make sure that any PPI activity that happens in the council has some consistency in its approach and basically has a method to the madness. And people were quite interested in it and people responded quite positively. So building on that and those discussions, then in April, we had our community roadshows. We went to all 6 towns to tell people what the HDRC is and how people can get involved and what are the various things we can or cannot do to basically explain the concept of the HDRC as much as we can. And there too, we had the opportunity to talk with people about the strategy, about what we were thinking about it, and we gathered a lot of input from there. And people also expressed their interest in being a part of the development of the strategy, and that's how we recruited for the stakeholder workshop. Next slide, please. So with everyone who expressed interest. Now, the stakeholder workshop itself was quite an undertaking because we invited a lot of people to the workshop. And initially, well, the RSVPs initially weren't that encouraging. Or let's say we thought that the workshop would be a small workshop, so we could have small group discussions. So initially, we planned the workshops to have small group discussions. But on the day, many people turned up who didn't say that they would. So it was, I mean, you might say now that it's a good problem to have because you had the diversity of voices, but trust me, on that day, it was a logistical nightmare kind of because we prepared ourselves, we designed the workshop to have small group discussions, but we ended up having to have like a massive focus group kind of thingy. When we were spread over 2 rooms, this is just a picture of 1 room. So yeah, we had lots of people. And there in the workshop, the workshop was designed in a way that we initially asked people to map what they know about the existing PPI activities in the council, both externally and internally, and we wanted to know from everyone present how the council engages with them, and we wanted to have both internal and external perspectives on the current engagement activities. And as you can see, we did it with sticky notes. We asked people to write their experiences or what were the various avenues of engagement and how people were doing it. What are the things we should link up with, all of that on sticky notes. We printed out the drafts and handed it over to the attendees. And we had the session where we discussed the drafts with them, and people got to basically leave their comments in those copies. So we had two large groups. We had note takers and facilitators. Erin and I ensured that the note takers and facilitators were not someone who was involved in the development of draft, because we wanted it to reduce bias basically, because we were so closely involved with it. We wanted someone who was unbiased to facilitate those uh, feedback sessions essentially. And then we collated all that and identified the following themes. So as I said, there was a lot of attendance, we had lots of people, and the aims of the workshop was to basically come up with a better draft than what we had. Well, so with the initial draft, when I took the initial draft to, as I said, internal and external partners and co-applicants, uh, the good, like the draft we took to the people before we took it to the partners, and trust me, everyone was very complimentary. People liked that draft, and I started believing that it was the next best thing to sliced bread. But boy, in the workshop, I have to eat the humble pie. Turns out the strategy had everything it needed to have, except the one thing that that it really needed, which was in an easy to understand language. Apparently, it was too jargon heavy. People felt that the draft could do well with being geared towards the audience that it was actually targeting, which was not limited to council employees, and it was something that the general public needed to be able to comprehend. And they felt that it wasn't that way, which was a very stark revelation for me, honestly. And it was also interesting that people, so when we go to the communities, I realized that day that you shouldn't have any preconceived notions. You shouldn't believe that you have something sorted, even if you have consulted with a lot of people and a lot of organizations, because uh, however much you do it, you don't know if that's exactly how it would be received by a more diverse group of audience. Pretty much my takeaway from that was that you need to engage as much as possible with the public to know where it is, because sometimes if you engage with the same kind of people, it could become an echo chamber and you wouldn't know what mistakes you were making. Like, I wasn't aware that the language was not appropriate. So the audience felt that the purpose was not clearly illustrated. They felt that there was a bit of confusion about what the strategy would do. Would it replace existing strategies of the council, or was it just restricted to the HDRC activity? In that case, what is the HDRC activity, and how would that interact with how the council does anything? And is the strategy linked in with everything that the council does? That was a recurrent theme. People really wanted us to work in an integrated way with the council, because they said they were sick and tired of being engaged with again and again, and when they felt that the council itself is not working in a more coherent fashion. And there were also talk about everything being in the true spirit of co-production, uh, and people expected that in engagement and anything should I don't know what just happened there. Engagement and everything should be more should be in a way that makes sense to them, and that shouldn't be repetitive. And as you might already know or may not know, Sandwell is a very diverse county area, a very diverse area. So they wanted us to ensure that everyone is included and everyone gets a table at the seat. And that was a very important priority to people. And people, as I said, it should link with existing work. It shouldn't be repetitive. And then there were some practical considerations around uh, payment policies, because payment policies did not exist. And Erin finally drafted a payment policy, which was new. And we reassured people that this won't be an extractive process, which is something they were really worried about, and that we are doing all of this to bring things into order so things can move on very smoothly going on. There were concerns about long-term visions in the sense that, okay, you came here and you have started this new thing. Is this thing going to last? Because people we have been engaged with many times and things seem to fall apart. So we have to be realistic about it, and we said that while we can guarantee the next 3 years of engagement, we can't really speak long term, but we'll try to make it as sustainable at a later point of time as we can, and that this engagement won't be a one-off, and that everything would be iterative. Over to Eden.
Thank you. So in terms of the following, what we did after we got all of this feedback, so we collated all the feedback together and developed a document just to check the accuracy of the feedback with the workshop attendees. So this was all sent out to all of the community organisations, residents, elected members and internal staff that attended the workshop, just so we could make sure that it was reflective of what they said during the day. We also, so what Priyanka has said around it not being accessible, developed a community summary of the strategy. So you can see that on the right hand side. So this just gave an overview of what we want to do, how it will work, and then the kind of 3 main principles and kind of promises that we'll be making to the community and residents for their engagement in the HDRC activity. And then finally, I know Priyanka has mentioned it, but the first draft was quite long and quite extensive after all of the feedback. So we amended the draft, taking all of this into consideration and cut quite a lot of it so it's a bit more easy to access, so that can go alongside that community summary, so that people can look at the document, easy to understand, but also look at that summary if they wanted to share it further afield. All of that was shared with the workshop attendees, and they were given an opportunity to offer any more feedback as well. And then our next steps, so like I mentioned, we want to make sure that we can publish this strategy, so hopefully during our next HDRC board this will be signed off. We are hoping that this strategy can be a working document, so that we can amend it as and when kind of things change within the HDRC, because it's so new, everything is changing within the community aspect as we go on. So we want to make sure that we can amend it, and it's amend it in partnership with the community as well. We will be hopefully soon having our community steering group in place. We're just going through all of the internal kind of procurement processes for that, but they'll be offering guidance for our work, but also be an avenue to amend the strategy as and when needed. So if we're not reaching specific groups, do we need to add more to the strategy that's going to focus on that, and how we're going to do that? And then finally, further engagement opportunities. So we are looking in the start of next year to have some accredited community research training. We're also going to do some baselining in the community around research, perception, involvement, and then any kind of development and training needs that the community sector and also residents might have, and then hopefully develop some subsequent training for the voluntary sector as well. And then finally, we thought it would be quite good to just say some learning points and things that maybe if we were to go back to the start, we'd do differently. So main learning point, which I'm sure all of you will be more than aware of, is that community involvement is key. So as I mentioned, this was something that we needed to get done within kind of the first year, 2 years of our delivery. So due to the time limitations that were on us, we couldn't really do co-production in its truest sense. But ideally, if we were doing a plan like this, it would be getting people from the community, residents, organisations involved in developing the plan from kind of the get-go there. And be clear around aims. So I know, like Priyanka mentioned, this was a lot of the feedback. So people were a bit confused how it was different to any other community engagement plan that we had within the council. So we needed to be a bit more clear to begin with on actually how this was different and how it was getting within a gap within the council that we've not already got there, and then identify your target audience. So again, the first draft wasn't accessible at all. It was more an academic internal facing document, whereas as it's a community engagement plan, we want to make sure that it was accessible by all and they can know how they can get involved and influence the work we're doing. So again, we needed to identify the target audience and be more clear on that. Again, there's a lot of other things that we need to still do, so making things a bit more accessible for different community languages, different disabilities, visually impaired people as well. So there is still quite a lot of work we can do, but hopefully our community steering group will help to guide this and target those gaps really that we've missed there. Lovely. So that's all from us. Thank you.
Great. Thank you, Priyanka and Erin and Natasha for sharing those examples and once again being honest and where it hasn't quite worked and how you've changed it. There are some comments in the chat, there's some questions, but just does anyone want to raise their hand now and ask anything verbally? Anyone got any questions for any of the speakers today? Louise.
Hi everyone. It's really great to hear the fabulous work you've been doing. I think it's coming from the landscape of working in the same as you do. It's really challenging. It's really difficult. We don't always get it right. We go back to the drawing board. We start again, and it's very labour intensive. There's hidden labours, hidden emotional labours with this role. Just thinking about the wider collaboration. When you're developing your HDRC strategies, did you collaborate with your local NIHR applied research collaborations? Because we've already got strategies in place. We don't work necessarily with patients. It is more about wider communities, local priorities. We've got some of those networks in place already. And for us personally in the Southeast, as an ARC, Applied Research Collaboration, we do work closely with the HDRCs. So it's kind of that partnership working. So I just wondered if you'd had that conversation, worked together, took on some of their ideas, shared some of yours, because sometimes it avoids that research fatigue in local communities because they'll say, well, another NIHR organisation is asking me the same thing and I'm already involved in that. So I just wondered how you'd kind of approach that. Had you thought about reaching out with them? And also there's local research engagement networks, RENs, who are within our area already training community researchers. So if that's something you're looking forward to in the future, that might be a good collaboration or conversation to have as well. But it's really, really great to hear what you're doing. It's really smashing. Well done.
Thanks. Natasha, Erin, Priyanka, anyone want to share any experience with your collaboration with other bits of NIHR?
I can see we have collaborated with Paul Bird, who's part of the ARC for kind of our local areas. He's been involved in some of our community engagement and the events that we've had. And we did as well, I think, look at their plan to kind of have a look at how they've done it that wasn't patient, but there's definitely a lot of other aspects of NIHR that we need to tap into. So I think if anybody has any connections that we can tap into, that would be really helpful and appreciated.
Thanks, Erin. And maybe it's something the Specialist Centre could help with as well. Natasha, how about in Doncaster?
Yeah, so in terms of where the journey started, I know the PICE event that we had last year, we did have the NIHR at that event. So they were part of those, as well as the local government and VCF sector organisations. So they were in on the conversations in relation to the diamond ranking exercise. I can't remember the gentleman's name off of the top of my head, but yeah, there was definitely involvement from the NIHR there. Probably less so in terms of the RENs. So particularly interested in linking with them. And that is something that's been on my radar for a while because we're also developing the research champion type role as a piece of work that's kind of alongside the creating the strategy. So that's something definitely that's put that on my radar again for me to pick up next week.
Great, thank you. Just to say, if we don't get to answer all the questions particularly in the chat, we'll do a follow-up as well with speakers. Zahid Ahmed.
Thank you very much, Kasia, and thank you very much to all those who presented. It's very good presentations. I have got a couple of questions for Priyanka and Erin. My first question is that, when on one of your slides you presented that obviously you invited a range of stakeholders, community sector, voluntary sector organizations, council staff, and some others. So with regards to the council staff who you invited to those meetings to participate, did you focus only on HDRC or public health staff, or did you include people from across the council from different directorates? Because wider determinants are quite wider, as the name suggests, and the whole of the council is effectively involved. And secondly, the PPIE strategy, which you talked about, obviously most of the NIHR stuff focuses sometime on the patients, but obviously we need to tailor things which suits the local authority needs. And that's where HDRCs and LARP, I'm one of the LARP, local authority research practitioners, that's where they are working to meet the needs of the local authority and learn from the NHS and NIHR. So could you share a draft of your strategy, or is it available? If you could guide me, where can I get that, please? Thank you.
Yeah, I can answer this. So in terms of the council staff that we invited, we did invite wider than public health. It was mostly people that were involved in community engagement, so people from youth services, housing, a youth forum team that we have, and then also some of our cabinet members for different areas. But again, we still need to widen that involvement within the council, within the community engagement aspect. But yeah, we did invite more than public health. And then the second one, hopefully once it's signed off by our board in January, we'll be able to share that. So we might put that on our website. So once that's on there, we can share a link to that and you can have a look at that and the kind of accompanied in documents as well. I hope that's answered the questions.
Yeah, thank you very much.
Erin, just before we move, someone asked in the chat about the kind of involving professionals, employees. Did you make a payment to them?
No, so we didn't for the council staff. And the reason I did see the message, the reason why we involved them is because they're involved in community engagement. So that's why we wanted to see that they could give us an idea of what they're already doing so that we're not duplicating things and they're aware of what we're doing as well. So that was kind of the reason as to why we involved the professionals. But no payment, but we are within the HDRC trying to look at internal research champions. So there might be some way that we offer some payment or something for their time within that.
Thank you, Erin. Just for time, we've got 6 minutes left. I'll go to, is it Juan Pardo? Have I pronounced your name right?
Yeah, that's correct. Thank you. Thanks very much. Very, very interesting. 2 quick questions. I don't think it's going to be quick answers, but I'll try to be quick with the question. One, Priyanka, I really liked your presentation. That was really good. One of the things I was quite interested to see is in the strategy approach, which is something quite arid for people to get engaged and involved. Why did you think those people got engaged in the first instance? My experience is if it's not something practical, something tangible, sometimes very object or subject related to something that's very known in a specific area, is quite difficult. Second question is for everyone and almost builds from that one. People who engage, again, experience engaging with people is there's a level of venting frustration, engagement. Do people who engage again, and do they consider themselves as reps of those communities? Because I think someone mentioned before the issue of potentially becoming representatives sometimes of communities that perhaps are not so, and again, it's an issue of that in relation to how you ensure that there's a view from the whole community, not just one specific part of the community. Thank you.
Thank you for the question, Juan. Well, the thing is about the first bit that you said, why do I think so many people wanted to get involved? Well, honestly, like you said yourself, it was frustration. They were frustrated that we keep the council somehow, different directorates of the council keeps coming up various strategies. They all get involved in drafting them, and then nothing ever happens. So I think some of them were really there to try to see if we were doing more of the same or were we doing something new, and see if I think they kind of wanted to admonish us if we were doing more of the same, but not just in the direction of not doing that. And that was the emphasis. Most of them emphasized that we really needed to work together. Everyone in the council needs to work together. And like you said, some people, like some members of the community might feel like they're speaking for everyone, which is also a thing. But these people had been working with the communities for so long, and they have been working so closely with the communities for so long, that they did feel that they could speak for their communities, but they never said that our voice is the only voice that you need to hear. But they had a lot of experience with working with the council on various different strategies. Like I said, Sandal Council actually does a lot of public engagement. So we emphasize that our strategy, initially at least, has more to do with research, and we don't intend to replace any other strategies but work in tandem with everyone. So that made people quite reassured. But these center figures of communities did say that while they are speaking for them in this particular event, they don't feel that their voice is the only voice, and they invited us to come to their communities in person and engage directly with the communities. And we got a lot of insights from people, even when I said that when we went to the 6 towns twice to discuss the HDRC and our ideas, there too we got the same feedback. So the smaller organizations invited us to work more closely with them, because they did feel that the larger organizations somehow get the bigger say in things. So we did take that into account, and we'll make sure that in the community steering group we have representation for everyone. Thank you.
Thank you, Priyanka. Natasha, I don't know if there's any reflections on that from Doncaster's work as well.
Yeah, just to build on that, really. So we've always got what we call the usual suspects when it comes to underserved groups and co-production and consultation. So we've got certain people who represent communities, and as part of the HDRC, and definitely as part of this type of work, in terms of it being fully co-produced, we really wanted to not move away from that, because obviously those people are really valuable in terms of the relationships that we have with them and the fact that they act as conduits into certain communities, but be cognizant of the fact that they don't represent all of those communities that they serve. So we've, like Priyanka's just explained, we've taken the opportunity to go out into those actual communities so that we're getting a wider spread in terms of opinions and thoughts and feelings around research priorities. So it's not just hinging on those usual suspects.
Thank you, Natasha. It is 1 minute to 11, so we will leave it at that. There have been other questions, particularly about elected members and other things. So what we'll do is, to not keep people longer than the hour, we will follow that up with a quick email with your responses to that, if that's okay. So I'll follow up with you, Natasha, Erin, and Priyanka. Thank you for your time today. Thank you to Natasha, Erin, Priyanka, and also Donna for kind of setting the scene at the start for us. Thanks for everyone for joining, for your questions and comments. Would you please also, just a call out, if you are looking to do a strategy or you're working this, please contact us. I will leave my email address in the chat. We'd love to hear from more local authorities who are thinking of developing a strategy in this area, and how we might be able to support you from the specialist centre as well. Have a lovely day, everyone. Stay warm. It's very cold in Whitley Bay here today, where I'm joining you from. And good luck with all your public involvement and community engagement work. Thank you, everyone. Bye.
Bye.
Thanks. Bye.
Bye.